This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Methyl Forte P Tablet is utilized for the management of neuropathic pain. It combines Pregabalin and Methylcobalamin to provide effective relief. Indications and uses. This medication is primarily indicated for the management of neuropathic pain, which arises from damage to the nervous system. It helps in alleviating pain associated with conditions like diabetic neuropathy, postherpetic neuralgia, and fibromyalgia. By targeting the underlying mechanisms of nerve pain, it provides significant relief and improves the quality of life for patients suffering from these debilitating conditions. How it works. Methyl Forte P Tablet works by rejuvenating damaged neurons and interfering with pain signals, leading to effective pain relief in various neuropathic pain states. Directions for use. Take this medication exactly as prescribed by your physician. Swallow the tablet whole with a glass of water, do not crush or chew it. The doctor will determine the appropriate dosage and duration based on your individual health needs, age, and body weight, ensuring optimal therapeutic effects. Possible side effects. Common side effects may include dizziness, sleepiness, headache, dry mouth, and mood changes. If you experience any severe side effects or if these symptoms worsen, it is essential to consult your healthcare provider. Precautions and warnings. Before using this medication, inform your doctor about any existing health conditions, especially if you have a history of substance abuse, kidney or liver issues, or if you are pregnant or breastfeeding. Caution is advised when driving or operating heavy machinery, as dizziness or sleepiness may occur. FAQs. 1. Can this medication affect fertility? Yes, there may be risks associated with male-mediated teratogenicity. 2. Can it cause weight gain? Yes, it can lead to weight gain due to fluid retention. 3. Is it addictive? Yes, there is a potential for substance dependence. 4. Can I stop taking it if my pain subsides? No, consult your doctor before discontinuation to avoid withdrawal symptoms. Thank you for watching. If you have any questions or suggestions, please leave a comment below.